Right now, dispatchers with Tempe 911 are taking on a new challenge, deciding which calls should go to mental health experts and which calls should go to police.
It's been almost 2 months since Tempe police partnered with mental health professionals in an effort to provide specialized help instead of an officer response.
Teen 12's Adriana Loya takes us behind the scenes with a look at how this partnership is going.
Tempe Police, do you have an emergency?
No matter the situation,
He was threatening to 240 one of the employees.
when you call 911,
Go after they hit you.
it is dispatchers who first help you with your emergency.
The heart behind public safety.
They are tasked to assess, interpret, and relay information in a fast, accurate, and calm manner,
It's life-saving work.
even to de-escalate crises over the phone.
I became drawn to it and I gave it a shot, and here I am 10 years later.
For a decade, Heather Brennan has been a dispatcher for Tempe Police.
You are the first voice that someone's talking to, often in what may be the worst moment of their life.
Critical work, she says, involves getting the right resources to those on the other side of the call, no matter the type of emergency.
Do you see any weapons on him today?
But starting in February, when someone called saying they had suicide thoughts, dispatchers transferring those to Tempe-based nonprofit Solaris Crisis and Human Services.
It's proving pretty effective.
And with the help of a professional on staff 20 hours a week, dispatchers also transferring other mental health-related calls.
But so far, we've been able to divert a lot of calls.
Tempe Police estimates 65 calls since the partnership began. They say that's a good sign that dispatchers now have a better tool to divert calls to mental health professionals in situations when an officer might not be needed.
That's the potential for one less officer involved, ... to happen, right? And so to me, that's the win.
Communications Bureau Manager Tanya Logan says there have been some kinks rolling out the program. Sometimes officers still must show up to scenes because of safety concerns, and they're dealing with staffing shortages. Still,
If we diverted one call and one call was a success, it just marks success, because a year ago today, we didn't have that resource.
So they are first responders.
Carlina Orozco also working on new techniques and procedures to help Tempe dispatchers and police officers better assist people with mental health issues.
So that it's resolved in a more comprehensive and final way, and that everyone receives the services they need.
911, what's your emergency?
And as the first person to assist you in an emergency,
We'll get police going.
providing those tailored resources.
So that means a lot.
Adriana Loya, 12 News.